Dear friends, welcome to my Geriatric Medicine channel. Today I am going to talk about constipation with which the elderly people suffer very frequently. Some elderly person goes to the toilet daily and still complain of constipation. What's the reason? So what is how do you define constipation then? There are two types of constipation. An elderly person may pass stools daily, but it will be hard and sticky. Stools may not be hard, but the movement of bowels will be irregular. He may pass stools once in 2 or 3 days, many a times. So, what are the common causes of constipation? Hello. So, intestinal diseases are the most common causes of the constipation, like cancer, obstruction of the bowel movement, hernia, piles, fissure in the anus are the common causes. Especially the fissure in the anus, because the pain during defecation, passing the stool, patient hesitate to pass the stool and retains it even though urge is there. Next is the hypothyroidism. The thyroid secretion, if it is low, then the constipation may occur. Depression due to various environmental factors, house factors, and social factors. Patient may suffer from depression for which he takes the drugs very frequently, which they also causes constipation. The lack of adequate fibrous diet, like vegetables, if he doesn't eat vegetables and other foods which are rich in fibers, then the bowel movements may be restricted and patient may suffer from constipation. Lack of exercise. Lack of exercise is another factor with which the patient suffer from constipation. The exercise, especially the walking for the senior elderly people and others, uh, the walking does cause movement of the intestine and the patient will have the urge to pass the motion stools and the constipation will be relieved. Then the drugs like iron tonics, painkillers, antacids, sleeping tablets, etc. will cause constipation in many elderly people. And so, how to manage constipation without a laxative? It is very easy to take a laxative, but it becomes a habit for me, habitual. And so, without a laxative, how to manage constipation is the problem. Most of the elderly people take laxative unnecessarily. Constipation can be managed without laxative by following guidelines. A high fluid intake must be maintained. An elderly person should drink at least a minimum of 2 to 2.5 liters of fluids per day. The approximate calculation is 30 ml of water per kg of body weight per day is the normal rules. Regular exercise like waking, sorry, regular exercise like walking should be encouraged. Every day, if the elderly passes, uh, walks through the garden or in the roads, etc., for half an hour every day, that should be encouraged. If any drugs are responsible, it must be stopped or dosage may be reduced. To include high fiber diet, the elderly should include in their diet about 40 grams of dietary fiber per day that is available in the market in under various trade names. There is a good deal of fibrous matter in wheat, ragi, horse gram, and rice bran. There is plenty of roughage in greens, plain, plantain stem, cabbage, cauliflower, drumstick, bitter gourd, dates, mangoes, figs, guava, wood apple, pepper, coriander, dried chilies, omum, fenugreek, and other vegetables. They contain high fibers. That's the lady's finger also contain lot of fiber. Milk, sugar, fat, eggs, meat, and fishes are devoid of soluble fibers. That should be considered. Are there any other benefits with high fiber diet? Yes, there are. Dietary fibers not only prevent constipation but also reduce the risk of cancer of the colon, reduces the blood sugar level and reduces the cholesterol level and incidence of the gallstones. The stones in the gallbladder may also be reduced with high fiber diet. So patients should be encouraged to take high fiber diet regularly every day. So from the list of food items mentioned earlier, they are very essential for the patient or the elderly people who to overcome constipation. Dear friends, these are about in a nutshell about constipation. Go through it, read it, share it with your friends, subscribe it. Thank you very much. Jai Bharat, Jai Karnataka. Thank you.